of Mississippi, in conversation with Sheryl Gay Stolberg, Washington correspondent at the New York Times.
Well, hello, Dr. Dobbs.
Good morning.
Good morning. It seems our clock is already ticking. First, I want to address the elephant in the room. You are that Dobbs, the Dobbs of Dobbs versus Jackson Women's Health. I know that your name was on that case by no fault of your own, but through by dint of your job. But I'm wondering, how has it been to have your name on this landmark health case?
It's been kind of a surreal experience, to be honest. It's not something that I had any interest in being involved with. Actually, I had strong interest to not be involved with it at all. Actually, the case was named after my predecessor, Dr. Currier, and it's just a quirk of me being the head of the regulatory agency that oversaw medical facilities. It's been pretty bad.
And if I'm not mistaken, she resigned. She stepped away, perhaps in order to have her name removed from that case? And I wonder why you didn't do that.
Well, I think she was, she had done a long tour of duty, and that was a plus to sort of be removed from that. But no, and it's just one of those risks, right? It's kind of collateral damage. If you want to do good work in a red state where these sorts of challenges are, you have to take these sort of risks, and that's kind of how it played out.
So more to the point of bridging the political divide, you've worked in a very red state. You had said that early on there was kind of a unity about how to respond, but then the unanimity devolved over time. And in 2021, months before the Delta wave, Governor Tate Reeves eliminated the mask mandates throughout the state. And I wonder how you dealt with that.
The Delta wave was the worst by far because it was, I think, mostly preventable. And if you look at states that were more thoughtful about preventing COVID transmission, you can see an entirely different wave of mortality and hospitalizations than we saw. Early in the pandemic, everybody was scared, and there was some more unanimity. And we fought together, and we crushed the first wave in the spring of 2020 in Mississippi. But after that, there was a lot of return to normal sort of thought processes. Fortunately for me, and I wasn't an appointee of the governor, I actually had a board of health, so I had some autonomy. And I think the governor actually kind of liked it that way. He could sort of disavow himself of my actions, which was fantastic, and he allowed us to disagree. And so while he refused to do anything, I respected his role, and I respected his authority, which obviously as the elected leader of the state, he has. But then we were able to work sort of behind the scenes with communities that was like more willing partners. Mayors specifically were great targets to sort of work with, and we did have some small areas of success, finding various lanes of opportunity where we could prevent death and morbidity where we could.
Yeah, so Mississippi also has a very diverse population. 40%, nearly 40% African American. It's also, as I said, a very conservative state. And I'm wondering, in thinking about vaccine hesitancy in those two populations, what did you do that worked and what didn't work?
It's such a great question. I can tell you where it worked really well. And kind of coincidentally, Dr. Adams and I met right before COVID, and he was meeting with actually our director of chronic disease prevention, Dr. Victor Sutton, who was well connected with a lot of the communities at risk. Before this, because of chronic disease and other stuff, barbershop initiatives, faith initiatives. And then when COVID hit, we recognized immediately that there were going to be massive health disparities. And so one of the things that we did that I think was kind of innovative, if you're familiar with the incident command structure, which is sort of like the disaster response thing, we actually elevated Dr. Sutton to a command level post, consistent with like logistics and everything for health equity. So every decision involved him involved in sort of the operation. And so that was very successful because he had pre-existing relationships with people in the community. We were able to find out what folks needed. And part of it was asking the questions to understand what people's perceptions were. What we found out pretty quickly is there was a theory, or basically a thought process, that in certain parts of the community there was mistrust, especially in the black community around Tuskegee and all that kind of stuff, which is legit. But when we really asked the question and did sort of broad surveys, what we identified as a bigger barrier was not engaging people where they lived. Instead of having these sort of massive drive-through clinics, folks didn't feel comfortable doing that. They wanted to have small local drive-throughs. And through totally shifting our paradigm, we were able to sort of massively improve our vaccination rate in those parts of the population.
But I want to jump in and ask you about
Yeah.
the conservatives, because I suspect that was a lot harder.
It
And how
was-
did you do there, and what did you do there?
So interestingly, with the faith community, it was an utter failure.
Why?
Well, when I would talk to the ministers, especially in the evangelical side of the ledger, they said, my congregation will flay me alive if I go forth advocating for vaccines, because it had become such a hard political thing. Now, what we found, there was different targets we could do on the more conservative side. Mayors were pretty good, and even within these conservative congregations, there were, especially older people, who were bearing the brunt of the mortality, were really open to vaccination and prevention. So trying to find our areas to sort of squeeze in there a little bit, but there really was sort of crazy opposition, and one of my good biking buddies was a Baptist preacher, and he gave me a lot of insights, which is fascinating.
So I'm curious, Dr. Adams mentioned his book. I don't want to be self-promotional. I actually am working on a book about politics and public health that explores some of these themes, including why conservatives, and particular Christian conservatives, have seen a declining faith and trust in public health. And I just wonder, why do you think? Why has that happened?
It's probably not as old as we think, and I don't know if part of it's an engagement piece in having these sort of relationships, but reading about the yellow fever outbreak in the 1800s, there were a lot of similar themes, and so it's kind of a recurrent theme of this conflict between individual rights and public safety. And we see that over and over again, and in the South and the red states, it's a lot more profound.
Yeah. We have 1 minute and 30 seconds left. I want to ask you about vaccination in Mississippi.
Mm-hmm.
Mississippi was long the state that had the highest vaccination rates in the nation, childhood vaccination rates, and the tightest rules. But last year, I wrote about this, a court ruling eliminated or reinstated rather, the religious exemption. And I'm wondering, are you worried that more and more parents are opting out and a vaccination, and what do you foresee?
I am very worried about it. I do think we're going to see some outbreaks. Years ago, like 1990s, we used to have ICUs regularly filled with kids with meningitis from Hib, H-flu influenza, and that's gone, right? We feel like these are things in the remote past, but they're not the remote past. They're going to be back on us again. Now, we'll have to find other avenues to be successful. Our physician community, our pediatricians are very strong advocates. We'll have to continue to work with them as trusted communicators with parents. What worries me more than the religious exemption, because we haven't seen as much of that uptake as we thought there would be, is this sort of pervasive misinformation. It's insidious, it's dangerous, it's troublesome to see that people enjoy believing lies,
So
and this is what worries me.
10 seconds,
Yes.
7 seconds to go. What's your advice to state public health officials operating in a very polarized climate?
Find your role, right, and honor it. Engage with the political leadership so that they make the hard decisions, and listen to people and hear what they want, and don't make assumptions, because we made some bad assumptions.
Okay, thank you so much.
Thank you.
Let's give a round to Dr. Dobbs.
Thank you.
Thank you so much. It's good to see you. And